This short video is just to help those that saw my Facebook live on heart failure and couldn't see the heart which I was showing because of the poor internet connection. This is the larger model that I was showing with the arteries down the front of the heart in blue veins and red arteries carrying the oxygenated blood. I explained that the blue pipe, which is the pulmonary artery, is carrying blood from this right ventricle behind here, which sends it to the lungs to get oxygen, and it comes back in through the mitral valve here, which, looking from the back, you can see the left atrium where the oxygenated blood comes into the heart through that valve and is pumped by this muscular chamber of the left ventricle, which is the one I said could be damaged by heart attacks and scarring that cause it to fail. And that blood is pumped out, and underneath here you can see this 3 leaflet valve called the aortic valve, and that allows the blood to go one way out the aorta and not leak backwards. And the right ventricle has got a tricuspid valve which lets blood go in from the body, coming in from the head end in blue and from the bottom of the heart, from the body here in blue, without oxygen, and it comes into this right atrium behind it, excuse me, and that feeds in through this valve. Now all these valves I explained are one-way valves and they should shut and stop blood leaking backwards, but if they're damaged, either by stretching of a chamber like one of these atriums that makes the ring bigger and it doesn't allow the valve to close and touch its leaflets together to stop the leak, it can cause a leak backwards. Similarly, if there's damage from infection like rheumatic fever causing scarring and distortion of the leaflets, they may not move normally and be narrow and let less blood through, and they may not close and oppose each other at the edges and therefore leak. So these are some causes I mentioned to you yesterday as a cause of heart failure, when the pump fails, either because the muscle's weaker or the valves leak. And then we talked about electrical circuits that pass down this septum from the pacemaker in the right atrium, where electricity travels slowly here and then rapidly down here to activate the ventricles. So I've given you a quick overview of the heart model, which I hope helps you when you review the Facebook Live from yesterday, the 3rd of November, which I did at 8 o'clock, and it's on the system to replay it, but you'll have to just stick with the audio mainly, and when I'm pointing to parts of the heart, which you see here, this will help you understand more clearly.